Welcome, everyone. The Best Practice Briefs is a partnership initiative of the South Dakota Foundation for Medical Care and the Great Plains Quality Innovation Network. My name is Stacy Fredenberg, and I have the pleasure of working for SDFMC, and also I work with the South Dakota Community Coalitions within the Great Plains Quinn. Before we begin, there's a few housekeeping items that we'll review. Today's session is being recorded and it will be posted at sdfmc.org on the Best Practice Briefs page. All lines will be muted throughout the presentation, but we encourage you to use the chat box to add your comments or questions, and then we'll address those at the end of the presentation. While most individuals work to avoid the emergency department, others consider it a source of primary health care. When emergency services are overused, the cost of healthcare increases across the board. The series that we're doing explores strategies for encouraging proper use of emergency departments. Today's speaker, Josh Ohrtman, is going to focus on moving forward with reversing drug overdose. Naloxone, or Narcan, has the power to reverse the impact of opioid overdose. Access to this potentially life-saving option is limited across the state, even as opioids continue to be prescribed and illicit use of fentanyl grows. Pharmacists play a valuable role for education and distribution of this life-saving medication, and Josh will highlight the challenges and the progress for improving screening, access, and reimbursement for the South Dakota pharmacies. Thanks for sharing today. Josh, I'm going to stop sharing my screen and I'll let you begin your presentation.
Okay, thank you, Stacy. I think that should be showing up on the screen there. Is that accurate?
I'm not seeing it yet, Josh.
Okay. One more time here.
There, now you.
Okay.
Now
and then I'll go ahead. Perfect.
We're seeing your slide sorter too.
How's that looking?
There you go. There you go.
Okay.
Now you got
it.
Perfect.
Thank you, Stacy, and thanks everyone for tuning in this morning. As Stacy alluded to, my name is Josh Ohrtman, and I am a clinical services pharmacist. So I do, in addition to traditional dispensing in a community pharmacy, I also work on a variety of clinical service projects. And that'll be one of the projects that I'm going to be talking about today is the use of Narcan and the model for Narcan distribution. The objectives of the presentation this morning really will just hit three main points. We're going to talk about how pharmacy, particularly community pharmacy services, are able to reduce overdose by providing access to Narcan. We'll talk a little bit about the eligibility and reimbursement processes for patients and the ability to receive naloxone. And then finally, we'll touch on some different strategies and methods to improve risk screening. So that can be everything from substance use disorder screening to overdose risk, and then the education to reduce that risk of overdose and addiction. It doesn't take very long on a quick headline search. We know fentanyl deaths continue to rise. We know the presence of fentanyl is having a significant impact in our country right now. I just did a quick search and immediately pulled up multiple headlines everywhere from the Washington Post to the Wisconsin Department of Health Services. We know fentanyl and overdose deaths are increasing in this country. And this is, not just a sensationalized issue here. This is, actual data shows from the CDC that the national overdose deaths are increasing at a very rapid rate. These data are from 2021, and we can see that was 80,000 deaths from overdose, opioid overdose. That number from 2022 is well over 100,000, and this number continues to increase. And these opioid overdose and fentanyl deaths are not just something that's happening in our big cities. It's not just a East Coast or a West Coast issue. This is happening in South Dakota as well. We see from the year 2012 to 2021 that opioid related deaths in South Dakota alone have doubled, and that rate will, we hope to impact that, but it is a staggering statistic when we look at what's happening in our communities and neighborhoods across the state. Fortunately, there is something that is available that can help to reduce some of these overdose deaths. The U.S. Food and Drug Administration promotes the use of naloxone or Narcan to save a life during an opioid overdose. Most on the call this morning are probably familiar with naloxone or Narcan. Narcan is a brand name for a product. The generic or the chemical name is naloxone. The way this product works is by displacing the opioid in the central nervous system from receptors, and then doing so, it will reverse the respiratory depression, sedation, and hypotension that the opioid is inducing in the individual during an overdose situation. Traditionally, Narcan is administered as a nasal spray. It's administered into the one nostril. If there is not a response, the second of the pumps can be administered 2 to 3 minutes later into the additional nostril. The product does come in both injectable and IV formulations, but traditionally in our community setting, we're going to see the nasal spray just due to ease of use and access. I want to point out that the use of Narcan or naloxone is effective for all opioids, and that does include fentanyl. So if we have this product that essentially will reverse an opioid overdose, why is it that we're still seeing opioid deaths increase? And I'm not going to go into the background on substance use disorders and those types of issues, primarily just focus on why Narcan deaths are occurring, or opioid deaths are occurring despite having the presence of Narcan. And so what we can see is that there's really challenges with Narcan access. It comes down to two different issues. There's both a patient challenge and then a provider challenge in patients receiving Narcan. We take a look at the patient challenges first. There's several. There's of course cost, and the product traditionally can be over $100 if the person does not have insurance or does not have the ability to pay for the product. So cost is certainly a challenge. General access to the product. Some of our patients that we're taking care of, they may have basic needs that they're not able to fulfill, things like transportation and just general storage or living arrangements. So, those are definitely challenges for patients to receive Narcan. There's a little bit of lacking of knowledge on how to use the product effectively. And of course, stigma. This is a quote that I wanted to share that I've seen that sums up that stigma quite well. And this is a direct patient quote, and it says, "I think that if you go to the pharmacist and bring it up that you are interested in getting Narcan, automatically red flags go up in that pharmacist's mind. Why do you want Narcan? Do you think you're going to overdose?" Then all of a sudden, there you are, the criminal again. And while that may not necessarily be what is going on in the pharmacist's mind, that certainly is a real issue for patients and needs to be addressed before we can continue to increase Narcan access. In addition to the patient challenges, we also know that there are provider challenges. Some of our physicians, you deal with many questions. There's uncertainty, there's concern about the different laws. Are physicians that prescribe Narcan, are they going to be scrutinized differently by different drug enforcement agency operations, things like that. There's questions about who can use Narcan, who can prescribe it, what about paying for it, and then of course how does a healthcare provider approach patients about the use of Narcan. And this is a pharmacist quote that I found, and this was in regards to the concern about offending patients. And here it is. I think for me, I think it might ruin a relationship, even knowing the background of somebody, but you don't want to step over those boundaries where you would ruin a relationship. Then they will go out and talk to their friends. Oh, she thinks I'm an addict. And so I think there's the patient challenges, but also the provider challenges in getting this life-saving medication out to patients. And despite these challenges, community pharmacies really do represent a great opportunity for improving access to Narcan for our communities. Community pharmacies are certainly one of the most accessible healthcare organizations. It's generally in some communities in the state, we know that a pharmacy may be the only form of healthcare for many miles. And pharmacies have generally good relationships with patients. They're in the communities that they serve, and therefore carry a level of respect and patient trust. And those are two very important points for providing Narcan access. Pharmacists and pharmacies are certainly going to be experts on medication use. And some of our pharmacies and communities have existing relationships with the South Dakota Department of Social Services, as well as treatment organizations such as Project Recovery. Therefore, these pharmacies may already have existing working relationships with some of the patients that may benefit most from Narcan. And that's what I'll finish the presentation on today, is discussing a partnership that the pharmacy that I work at in Rapid City, the Medicine Shoppe, a partnership we have with Project Recovery and the South Dakota Department of Social Services. And I'll talk a little bit about how that partnership came about and what the program looks like. So how our partnership came about is we reached out to Department of Social Services. We completed the necessary paperwork steps. It's fairly straightforward. We were then added to the Avoid Opioids South Dakota website, and I'll show you all what that looks like here. This is a website that if any individual wanted to obtain a Narcan prescription, they can simply go to the site here. They can type in the zip code.
Josh, you might
Yes.
have to stop sharing your PowerPoint and share your browser screen.
Oh, I'm sorry.
That's okay.
So that should be showing up now.
Yep, now we can
Okay.
see it. Thank
Yeah,
you.
so this, thanks, Stacy. So this is the Avoid Opioid website through the Avoid Opioid South Dakota site. And it's really convenient because basically any individual can type in their zip code in the state, and it will show the different locations in the state where a Narcan distributing pharmacy may be. So here we are right here, the Medicine Shoppe, address, phone number. As you can see, there's Narcan distributing pharmacies in Sturgis, Spearfish, Belfouche. And so this is a really nice resource and a good thing for patients to use if they're interested in that. So after we were added to the Avoid Opioid South Dakota website, we ordered the product from the supplier. We contacted our colleagues at Project Recovery and delivered some eligibility forms, Narcan eligibility forms to them, and then talked about the program with the staff there at Project Recovery. Now, one of the most important things for this program to be effective really focused on doing some education of our own pharmacy staff. And so what we did is we took designated time for staff and had several different training sessions. And we talked about some of the different laws around Narcan use. We talked about approaching patients. We counseled our pharmacists on looking at medication risks, opioid use disorder identification, program availability, and then referral processes if there was any sort of risk disorder that was identified. And so this was an important part of our program success, was certainly letting everyone in the pharmacy know what was going on with this program. The next step that we went through was to have the patient complete the eligibility form at Project Recovery. Then they can bring that form with them to the store when they come to pick up their medication treatment. We input the Narcan prescription as a standing order, very similar to a flu vaccine, and the prescription is filled just like any other prescription and billed appropriately to the patient's insurance if they happen to have it, whether it's Medicaid, Medicare, or commercial insurance if applicable. And then the patient would be counseled on the appropriate use of Narcan, when to use it, things to look for respiratory depression, breathing emergency, those sorts of things. And then in the situation where a patient may not be aware that they're eligible for Narcan, we would have different bag attachments and some printed materials that patient can look over as they're waiting for their prescription. And then we have a sign in the pharmacy as the patients enter the store that shows that we are a Narcan distributing pharmacy and tells a little information about the product. Now, I did mention payment and the product being billed as a traditional prescription through Medicaid, Medicare, or commercial insurance. For the patients that maybe do not have insurance coverage, or they might not have the ability to pay, this is where that DSS partnership really comes into play, because regardless of the patient's ability to pay, every patient that would like to receive the product can. And that way that works is that we would fill the prescription as a traditional prescription and then send a monthly statement to the Department of Social Services to let them know what was dispensed, and then DSS sends us a monthly reimbursement. And this has been just a wonderful program. In our first month alone, we were able to deliver 17 Narcan prescriptions to patients. And some findings, interestingly, many of the patients were already familiar with the product and were happy to hear that there was not necessarily a complicated process for them to receive it. We were featured on our local Rapid City News, but this is the program that we have. We just think that there's so many additional opportunities based on this model that we've seen, and we continue to learn every day from what we've done so far. So, for example, we are currently screening patients. We've had a lot of interest from the general community about Narcan. We're getting calls from maybe grandparents that might have an opioid prescription in their house for joint pain or things like that. And certainly the presence of fentanyl in non-FDA sourced prescription products online and non-US pharmacies is generating interest in having an opioid reversal agent in the house. And so we've seen a lot of interest from the general community about Narcan. And ideally, this model that we have put in place would really fit well with other South Dakota communities and pharmacies. And so we hope to be able to share, this with other pharmacies throughout the state and get them educated on the various components of appropriate Narcan dispersal. I did want to take just a minute to talk a little bit about the Avoid Opioids South Dakota website. It is a great resource for pharmacies, physicians, as well as patients. And I will take you there really quickly. As I had alluded to earlier, on this website, there are resources for providers, for pharmacies, and then this in general is just a great resource for patients. And so some of the resources that a patient can find on the Avoid Opioid South Dakota website. For pharmacies, there are different programs and descriptions and materials for Narcan distribution. There's resources on reporting, how to report Narcan use and distribution. There's a variety of patient materials that can be given to the patients in the store. There's also physician resources. There's training on Narcan, training on medication assisted therapy. There's resources for emergency department use and various treatment options throughout the state. And finally, there's patient resources. So these would be locations for addiction treatment, as well as access to Narcan via the pharmacy route. I want to close the presentation this morning with a quote from the administrator of the DEA, Ann Milgram. And she has said that fentanyl is the single deadliest drug threat our nation has ever encountered. Fentanyl is everywhere, from large metropolitan areas to rural America. No community is safe from this poison. And this is what I want to highlight right here is we must take every opportunity to spread the word to prevent fentanyl-related overdose death and poisonings from claiming scores of American lives every day. And that's really what this Narcan process is all about, is meeting patients at their level where we can directly communicate with them and share this product with them and hopefully make a difference on that staggering statistic on opioid deaths and work to reverse that trend. I'd like to thank everyone for their attention this morning, and I'll go ahead and open that up for questions.
Thanks, Josh. We actually have multiple questions that people have contributed in the chat, so I'll read these off to you so that you can answer them. What is the proper storage of Narcan? Can you have it in your purse, in the car? Do you have to worry about it freezing?
That's a good question. So Narcan should be stored pretty much as any other prescription medication. It is sensitive to heat, as well as extremes in temperature. The nice thing about Narcan is it does have a pretty significant shelf life, generally 1 to 2 years, but it can be stored at traditional room temperature.
It's nice to know that it'll last that long if it's good for 2 years.
Yeah.
We had someone say, a pharmacist just called my office. She has a client who's hosting a large event this summer, and they would like to have Naloxone available just in case. If the client does not have someone specific in mind for the Naloxone, would they still be able to obtain it through the standing order?
Yeah, the general rule is the Narcan is available for any individual that has the potential for coming into contact with someone that may have a breathing or opioid overdose. So yeah, that is something that even if there's not a single specific individual in mind, if there's the potential for that, yeah, that is something that is available.
And then Josh, how does that reimbursement work? So anybody who has the insurance, there's no prerequisite or anything there. They would get that Naloxone paid for through their own insurance?
That's correct. Generally, the copays through commercial insurance range everywhere from $10 to zero copay. So that's, the ideal route. If the individual was unable to, if the copay was the barrier for receiving the product, there is options available through DSS for the patient to receive that product.
So you don't even need to have an opioid prescription on file or anything. You can.
Absolutely, that's correct.
That's great. We had someone else say, I guess you just answered that. Can anyone obtain a prescription? You may potentially come across an OD. This is from a home visiting nurse who encounters a variety of different people. You just never know. Can you have more than one on hand, Josh? Like,
You can. There are definitely limitations through Medicaid. Commercial insurance plans limit to the number of covered prescriptions per 30-day period. But in the case of the DSS program, let's say an individual has their Narcan and it's used, in a worst case scenario, that product is used and the individual would like to get another product to have on hand. Yes, they can absolutely come in and get another one. There's a slot on the eligibility form where you would just say the previous product has been used and the patient would be able to receive it.
So Dodie was just asking, would you want it to be run through your insurance or should it be run through DSS? And I think, Josh, from what you're saying, you can only have it go through DSS it's only if is there a financial requirement through that to get it through DSS? Or?
Yeah, good question. So generally the Medicaid and the commercial insurance plans are going to have the limitations, the time frame limitation. DSS on their eligibility form, they do have the option for saying the product was lost or destroyed, and there would not be a time limitation if a person was needing to obtain the product through the DSS program.
Mm-hmm. So I'm thinking about the earlier comment about having it in your purse or having it in your car. I mean, there could be a situation where you would want it to be in multiple locations.
Absolutely.
So that you could have it easily accessible.
Yeah.
If you had somebody who was using an opioid or potential for overdose, either by not understanding how to use your prescription. I think about my parents who are older, who could potentially take too much accidentally. And so all of us kids being able to have that on hand in case we were with them and something happened.
Yeah, it could be thought of a lot like a fire extinguisher or an EpiPen or an asthma inhaler, something like that. We certainly don't ever want to have to use them, but it is nice to have them available if we do.
Right. And we had another question about the Good Samaritan law.
Sure. So yeah, that's something that's very good to bring up. So South Dakota does have the Good Samaritan law that does protect an individual if they do administer Narcan to someone to protect them from any sort of ramifications. And I do like, when this question comes up, I do like to remind folks that there is not a direct or adverse event that can occur from using Narcan. There's not any side effects from using Narcan in the event that a person may not be actually experiencing an opioid overdose. There really is not going to be harm in administering it to a person as a precautionary step. So that's just something I like to let folks know as well.
Right. We're getting close to our 30-minute mark. I'm going to just share a little bit of information. And if you have more questions, please add them into chat. We'll continue to answer them. But I just wanted to add that this session is part of a series that we're doing. So we have another best practice brief coming up next week that's going to be highlighting Project Recovery, which Josh mentioned earlier. And so you can learn more about that next week. And also just to put a plug in that, we do want to show best practices that are of interest. We like to bring forward great work being done by other entities. And so if you have a topic that you'd like to see information on, we'd love to hear from you. And I'm going to put my email in the chat box. Please reach out to me, or if you have a best practice that you want to share with others, we'd love to feature you as well. Things that align with our existing mission and vision for our organization. So with that, I'm not seeing any additional questions at this point. Josh, do you have any other comments you want to add before we close out the session?
No, my contact information is on the slides, and so if anyone thinks of something after the presentation, please don't be afraid to reach out. I'd be happy to help out.
Yeah, and I just also added in the chat a link to our evaluation. All of the recordings for our best practice briefs are on our website as well, and you should have seen that link come through. So we appreciate your participation today. Thank you very much, everyone, for joining, and have a great day. Thanks, Josh.